Hi, this is Bob Vineyard with the Georgia Medicare Minute. I had somebody ask me last week that said they've been talking to their friends, and their friends tell them, Medicare doesn't pay for much of anything. And he said, "What do you know about that?" And I said, "Well, I don't know." I said, "I've been on Medicare for almost 3 years now, and so far they've paid for everything that I would expect it to pay." He said, "Well," I said, "can you give me some examples?" And he said, "No, I just heard that they don't pay for everything." Well, okay, let's talk about that for a minute. Medicare Part A is the hospital inpatient portion. Part B is the outpatient. Medicare covers things that are considered medically necessary. Some things that are not medically necessary, you may want them to be covered, but they're not necessarily medically necessary, would be routine eye care and routine dental care. It's just not covered by Medicare. Those of you who have had health insurance through their employer should know that you may have had dental insurance and vision insurance and maybe some other kinds of insurance through your employer plan, but it was not part of your health insurance package. It was usually a separate carrier. It's a separate policy, a completely separate benefit. So when you go on Medicare, if you want to have regular eye exams or dental care, you pay for them out of pocket. Now you can buy policies out there. I don't think any of them are worth it, but you can buy policies out there if you want to spend $25, $35, $45, $60 a month or more on something that you could very well pay out of pocket. Most dentists and a lot of eye care professionals will give you a discount simply by saying, "Hey, I'm 65 and older. Do you have any discounts for seniors?" And by the way, you don't need a membership in a special club in order to get a discount. Just ask for it. Medicare also does not pay for cosmetic surgery. If you want a tummy tuck and eyebrow lift or, all these other things that are strictly cosmetic and not needed, you may want them, but they're not medically necessary. That's not covered. Acupuncture is generally not covered. Hearing aids and the cost of fitting them and so forth is not covered. Long-term care, now this is something that a lot of people get confused about. Medicare does pay for home health care in some situations. It does have some nursing home benefits in some situations. But long-term care that's a separate policy that you would need to buy if you want that type of coverage. Now that's something of all the other add-on insurance policies that you can have. The long-term care is something that I definitely would encourage people to look into. So that's pretty much it. No, Medicare covers just about everything that you would need it to cover, large medical bills and so forth. And the other stuff, dig into your pocket and pay that way. You take care. Have a great day.